Great.
Okay, good. So, can you tell us about your experience before you got the first penile implant? With erectile dysfunction and how that affected you and your relationship.
Sure. Obviously, very, very frustrating. Not able to really have sex very, very, very appropriately and very well, and just searching for ways, obviously, to resume our sexual relationship and to be successful. Very, obviously, very important to me and to know.
All right. And so, how many years ago was it that you had the first implant?
I had it when I was 12 years ago.
12 years ago.
When I was 48.
Okay, so that one wasn't with me, but you can, talk about what that experience was like the first time you underwent an implant.
Sure. That was definitely more painful than with you. I had very little pain after what you performed. It was, obviously it was worth the purpose, but it was, I was pretty uncomfortable for, I would say, a good couple of weeks.
Okay.
But obviously things healed, and it was very successful as well.
And then, in terms of your relationship with your wife and your happiness after that first procedure, you were
great. Yeah, very, very enjoyable, as if I didn't have an implant.
Okay. And then after 10 or 11 years, that old one stopped working, right?
It just one day, I think in September or October this past year, it just it was flaccid and I couldn't pump it up.
Yeah.
And, I guess it leaked or something.
Yeah, which is pretty standard. These things on average last 8 to 10 years. So at some point,
certain amount of pumps.
Yeah, especially people that have other medical history. They get an implant when they're younger. You can probably expect that they might need a replacement. So then you can talk about your experience going through the revision and deciding to have another surgery and so forth.
Sure. Well, obviously having another surgery was a no-brainer. To me it was a must. Obviously to continue our sexual relationship. And yeah, the experience with you was just great, fantastic, easy, not painful at all, and you were able to perform the surgery out very, very quickly, which was my goal, and hopefully I'll have many more revisions. I'll be able to last.
Yeah, in another 10 years.
Stick around a little longer.
Yeah. Yeah, I won't promise that everybody has as painless of an experience as you. I tell people to expect to have some weeks of pain like your first time, but I don't know why sometimes people just say that they had almost no pain, but it's great when that happens. Either way, the important thing is that after you heal, 6 weeks after the procedure, that you're no longer having pain and you're able to use the device.
Right.
So we can talk about that, what it was like once you got the new device.
Oh, sure. Obviously, waiting, obviously, since the other broke, and for you to put in the new implant and to finally use it was just fantastic. Yeah, enjoyable, and just having the ability to be successful is just fantastic.
Yeah, and wife is happy, and that's
wife
most
is
important
happy.
thing.
She's luckily she's wonderful, and she's understanding through everything. So she's great.
Okay, yeah, and that's what makes it all worth it. Going through all this stuff.
Yeah.
So if you just have any thoughts, if you have anybody that's has erectile dysfunction and they're deciding if they want to undergo a procedure like this, what you would tell them?
Absolutely, it's a game changer. If that's the only way you can be successful, it's certainly worth going through with it, and I think everybody will be very happy once they do.
Okay, yeah, and I would say we obviously don't have a 100% success rate, so there's always risk. So we tell everybody try everything else first, but if you're sort of out of options, then you have to sort of take the risk and the pain associated with the procedure and do it.
No question. Yeah, I'd recommend it.
Okay, awesome. Well, I think that's it. So thank you so much.
All right.
Appreciate it.
Oh,
Thank
you're
you.
welcome.
All right, I'll cut